Pneumonia and tuberculosis are serious respiratory infections. They can cause a range of breathing problems. These illnesses affect millions worldwide. It's crucial to understand these diseases for early detection and treatment. Pneumonia inflames the air sacs in the lungs, filling them with fluid. This fluid buildup makes breathing difficult and can lead to serious complications. Tuberculosis, on the other hand, is a bacterial infection that primarily affects the lungs but can spread to other organs. Early diagnosis is vital for effective treatment of both conditions. Recognizing the signs, symptoms, and risk factors can help individuals seek timely medical attention. This proactive approach can lead to better health outcomes and prevent the spread of these infectious diseases. Certain groups face a higher risk of contracting pneumonia and tuberculosis. Understanding these risk factors is crucial for prevention and early intervention. For pneumonia, the elderly, infants, and individuals with weakened immune systems due to conditions like HIV/AIDS are more susceptible. Chronic illnesses like heart disease and diabetes also increase the risk. Tuberculosis spreads through the air, making close contact a significant risk factor. Individuals living in crowded conditions or in close proximity to infected individuals are more vulnerable. Additionally, malnutrition, smoking, and substance abuse weaken the immune system, increasing susceptibility to tuberculosis. Knowing what causes these respiratory illnesses is key to understanding how they spread and how to prevent them. Pneumonia can be caused by various microorganisms, including bacteria, viruses, and fungi. Bacteria like Streptococcus pneumonia are common culprits. Viruses like influenza and respiratory syncytial virus, or RSV, can also lead to pneumonia. Tuberculosis, on the other hand, stems from a specific bacterium called Mycobacterium tuberculosis. This bacterium spreads through the air when an infected person coughs, sneezes, or talks. Understanding these different causes helps healthcare professionals recommend appropriate preventive measures like vaccinations for pneumonia and prompt treatment for tuberculosis to break the chain of infection. While both pneumonia and tuberculosis affect the respiratory system, they have distinct characteristics that help differentiate them. Pneumonia often presents with a sudden onset of fever, chills, cough with phlegm, and chest pain. Breathing difficulties and rapid heartbeat are also common. Tuberculosis, however, tends to develop gradually. Persistent cough lasting for weeks, chest pain, fatigue, weight loss, night sweats, and coughing up blood are hallmark symptoms of tuberculosis. This slow progression can make it challenging to diagnose tuberculosis in its early stages. Section 5. Diagnosis, unveiling the culprit. Accurate diagnosis is essential for appropriate treatment. Healthcare professionals employ various methods to diagnose pneumonia and tuberculosis. For pneumonia, doctors typically perform a physical exam, listening to lung sounds for crackles or wheezing. Chest X-rays help visualize fluid buildup in the lungs. Blood tests can identify the presence of infection and determine its severity. Tuberculosis diagnosis often involves a skin test where a small amount of tuberculin is injected under the skin. A positive reaction indicates exposure to the bacteria. Chest X-rays can reveal abnormalities in the lungs. Sputum tests, where a sample of coughed-up phlegm is analyzed, confirm the presence of Mycobacterium tuberculosis. Section 6. Red flags, recognizing the signs and symptoms. Early recognition of signs and symptoms is crucial for prompt medical attention and better treatment outcomes. Pneumonia typically manifests with a sudden onset of high fever, chills, cough-producing phlegm or pus, chest pain, rapid breathing, and shortness of breath. The cough may be accompanied by chest pain that worsens with deep breaths. Tuberculosis symptoms can be subtler, especially in the early stages. Persistent cough lasting for more than 2 weeks, chest pain, fatigue, unintentional weight loss, loss of appetite, night sweats, and coughing up blood are red flags that warrant immediate medical attention. Section 7. Fighting back treatment options and medications. Treatment for pneumonia and tuberculosis aims to eliminate the infection and manage symptoms. The specific approach depends on the cause and severity of the illness. Bacterial pneumonia is typically treated with antibiotics. The choice of antibiotic depends on the specific bacteria causing the infection. Viral pneumonia may not require specific antiviral medications, and treatment focuses on symptom relief. Tuberculosis treatment involves a combination of antibiotics called anti-tuberculosis drugs. These medications must be taken for several months to completely eradicate the bacteria. Failure to complete the full course of treatment can lead to drug-resistant tuberculosis, making it significantly more challenging to treat. Section 8. The Healing Touch, Nursing Interventions for Recovery. Nurses play a crucial role in the care of patients with pneumonia and tuberculosis, providing support and monitoring their progress. Nursing interventions for pneumonia may include administering medications, monitoring vital signs like temperature, pulse, and oxygen levels, providing oxygen therapy if needed, and assisting with respiratory treatments. For tuberculosis patients, nurses educate patients about the importance of medication adherence, infection control measures like covering the mouth and nose when coughing, and regular follow-up appointments. They also provide emotional support and address any concerns or questions patients may have. Section 9. Conclusion. Knowledge is power, protecting yourself and others. Understanding the difference between pneumonia and tuberculosis is paramount for public health. Early detection and treatment are crucial for improving individual outcomes and preventing the spread of these respiratory infections. Recognizing the signs and symptoms, knowing the risk factors, and seeking prompt medical attention are essential steps in protecting ourselves and others. By staying informed and taking proactive measures, we can effectively combat these respiratory illnesses and create a healthier future.